All set, Josie? Good afternoon. It's a sunny day in Washington State. We got a recognition for the second year in a row that the state of Washington is the best state in the United States. Something we celebrate, believe in, and with the progress we're going to announce today will be another feather in our cap, I believe. Today we have a boatload of good news. We will make progress today in increasing economic activity in our state. We'll make progress moving forward with more access to sporting events and other events in our state. And we'll make progress today by moving forward by increasing the number of people who are eligible to get this life-saving vaccine against the COVID virus. First, on the economic front, because of the work we have done in reducing the infection rate in our state, in reducing the hospitalization rate, we are now eligible to move forward on phase 3 of our economic recovery plan. I'm pleased to announce this. On March 22nd, every county in the state of Washington will be eligible to move forward to phase 3 in our reopening plan. And here's what this means. For essentially all indoor activities that are allowed, they will now be allowed up to 50% of capacity, up from 25, doubling our capacity. We're real happy about this. This means our restaurants, gyms, fitness centers, movie theaters, some of the hardest hit businesses in the Washington state will be able to return to 50% capacity. This is also going to include large outdoor and indoor facilities that can hold up to 400 people. This was provided it would not exceed 50% of capacity. This includes high school graduation ceremonies as well as concerts. Other minor industry-led changes are also coming to some categories. For example, alcohol service now will be cut off at midnight instead of 11 p.m. And our team is still working with industries to finalize some of the details in these industry-led changes. Those will be released next week. On March 22nd, we take one more step in beating the virus and reopening our economy. Now, because of the progress we've made in reducing the incidence of this disease, as well as our tremendous efforts to get people vaccinated, our reopening plan is now based on a on a county rather than regional basis. So the State Department of Health will evaluate progress every 3 weeks, and the first review will be April 12th. All counties' success under this plan will be monitored by 2 health metrics: the new COVID cases they experience per 1,000 and new COVID hospitalizations. Similarly, smaller counties will have a somewhat different criteria. For counties with more than 50,000 residents, that's 22 counties total, the rates you see on this graph will determine whether a county stays or moves in phases. This plan has an additional fail-safe. If at any point statewide ICU capacity reaches 90%, the county would have to move backwards into the previous phase. Now, we're excited to take this step forward. We're going to keep evaluating our progress. We think there's reason to be optimistic, and we think this gives us a way to keep moving forward. Second, on the issue of sports. So additionally, we're making changes to our sports guidance to allow more people to enjoy great athletic performances. It's been a year now since we've had a reduction in our chance to be spectators at sporting events. We're now at a point where we can safely move forward. So this applies to outdoor venues with permanent seating, and capacity will now be open up to 25%. What this means is, an opening day, we will be singing Take Me Out to the Ball Game, and we will be going to the ball game with the Mariners and other games. So the Mariners will be able to welcome fans up to, I think it's about 9,000 people on opening day. And of course, that's just one of our incredible teams that will be open in this regard. So this will have an impact, obviously, on more the Mariners. It'll include Sounders, OL Reign. It'll also additional capacity for high school sports, and we're really glad to be able to do that. It'll also allow motorsports, rodeos, and other outdoor spectator events under these same protocols. Now, obviously, we want to do this safely, So this will include protocols on doing this involving mask wearing, distancing, and other protocols. Also, assuming we continue to make progress, we're going to reevaluate this capacity limit in April and potentially increase the capacity limit on areas such as minor league baseball. We'll take a look at that in mid-April. We're also working on guidelines for summer camps and for safe and healthy expansion of youth sports. High contact sports like basketball, wrestling, and cheerleading will be allowed to have competitions again. Obviously, masks will continue to be required. And our hope is having more sports available for students is going to keep them more engaged. We know how important this is. And I really appreciate you sports, all of those volunteers who are helping coaching and reffing. This physical activity we think is really important in our mental health for our children as well. We hope these will go into effect as quickly as possible. I'm hoping we'll get those in place next week. So more to be said next week. Third, we're making big progress on the vaccine front. We now made good progress so that about 60% plus of our population age 65 has been vaccinated. We're also starting to see more open appointments around the state, and we want to keep filling up those appointments. So I'm very happy to announce that we will move to the next tier of eligibility here earlier than we thought. So on Wednesday, March 17th, everyone in Tier 2 will be eligible for the COVID vaccine. Now this tier includes workers in agriculture, food processing, grocery stores, public transit, firefighters, law enforcement, as well as workers in corrections, jails, and detention centers. It also includes over 16-year-olds who are pregnant or who have a disability that puts them at a high risk. This is another tremendous step forward in our fight against this pandemic. We're glad to be able to advance this even a week earlier than we thought we were going to be able to do to get more shots into arms as quickly as possible. Now, I would also reiterate, for those who are already eligible, you will remain eligible, and this is an important point. If you're over 65, you haven't had your vaccine yet, and for whatever reasons you haven't had it by March 17th, you will continue to be eligible throughout this entire pandemic. So those folks who on March 17th are eligible who haven't got it for one reason or another, maybe they didn't want to get it at that point, you will remain eligible throughout the vaccine program. And we encourage everyone to do this. This is a medical miracle. We have 3 extremely efficacious vaccines. Every day there is better news about how effective they are in saving lives, saving hospitalizations, and saving your loved ones. So I encourage everyone who's eligible to get a vaccine. So with all this good news, it is a little easy to forget that we still continue to have to fight this COVID with all of our tools, not just the vaccine. Vaccine is just one of our tools we have to keep using. We have to keep using masking, distancing. We have to continue to be safe in our hygiene. Because the reason we're able to make this progress today is because we have been safe, we have been diligent, we have been intentional, we have cared about our loved ones and ourselves. But we got to understand we are still in a fight. We have these variants out there, and this thing could spring back on us again. And the way I look at it is we're hitting COVID with the left, with the vaccine. We got to hit it with the right and continuing to pound it with masks and everything else we know works. And we got to keep pounding it until it's down on the canvas and can't get back up. If we do this, we ought to have tremendous confidence in having a good summer with a lot of joy in our state. And I'm glad we started this progress today. The American Rescue Plan now, I can't tell you how delighted I am that the President is going to sign this, or has this morning. We're going to receive substantial financial resources, and families will as well. Businesses, restaurants, workers, renters, landlords, counties and cities, families, students, children, help for vaccinations and public health measures. This is an amazing achievement, and it's going to mean big things for a lot of families around our state. The Office of Financial Management and my staff in Washington, D.C. are still crunching the numbers, but we hope to have a better picture soon about the relief that's headed our way in the state. The legislature obviously have a big role in allocating it, and I look forward to working with them and making those allocation decisions. I really want to thank our congressional delegation. They worked diligently on this. I want to thank President Biden. This is a big, big day for the United States and our state. I want to have a word about our folks in our long-term care facilities and our retirement homes. The federal administration this week issued new guidance addressing visitation policies on how to increase the ability for us to visit our loved ones while still being safe. And we are now reviewing that guidance, and we're developing a plan. And I think in the fairly near future, we will be able to open up new ability for us to enjoy our loved ones in these facilities. The vaccinations are helping us do that. And again, the more that we show good practices, the faster we will be able to do all of these things. So with that, happy to stand for your questions. We also have Lacey Fehrenbach from DOH and Nick Struley, our Director of External Affairs, that can answer questions as well. So, you may fire when ready, Gridley.
All right. First, we'll go to Rachel McCourt with AD. Go ahead, Rachel.
Governor, you mentioned the variants, and at the Department of Health news conference earlier today, there was some concern expressed about cases plateauing and these variants continuing to be found in the state. Is there any discussion on putting a renewed focus on regular rapid testing for people who are now going to be going to games or concerts in order to ensure that the state won't have to roll back?
Well, I don't think we have not embedded testing requirements in those protocols. But one of the things we are doing is having one of, and maybe the most frequent testing of the varieties to determine how prevalent some of these new varieties are in our state. And I credit our Department of Health for doing that. They're increasing dramatically the genetic testing we're doing of the virus to determine how active these mutant strains are. So I would say we're as good or better than any other state in the country in that regard, and I think that that is a good thing. We are seeing still, in my view, significant testing that gives us good surveillance about the activity. And we do have the hospitalization data, which is the gold standard, because when a person's hospitalized, we know about it. And there's very little variety in that. If you're hospitalized, you're going to be hospitalized if you need it, and we're going to know about it. So I feel good about our ability to monitor the progress of the disease. As you know, we've got great epidemiologists. We are briefed weekly by the Institute for Disease Modeling. By the way, can we put up the graph of the, if I can, just show the epidemiological curve that is prepared for us. And I'll just note on the right side of the curve, you've seen we've come down a tremendous amount from December. Then you've seen a plateauing, a little spike up, and again heading downward in the last week or so. We want to continue that effort going, and this is why it's so important for us to continue the masking activity. We think we're doing well in the race, both in the vaccination and continuing masking, but we need to keep that up.
Up next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
Governor, two-part question. First of all, regarding the Mariners, did you consult King County, and did they sign off on Mariners having fans back in the stadium? And second, with the new coronavirus relief package and previous packages, the state held on to a lot of that money for a long time to make it stretch. Are you going to be pushing the money out faster this time? Is that your intention?
On the money, I don't know how I would characterize it. We'll distribute it in the right manner at the right time. I don't think there's any particular plan to peg it either faster or slower as the same as previous distributions. We'll make a judgment based on the unique characteristic of these dollars. But we understand there's a lot of needs out there, and we'll certainly be observant about that. As I think about your question, I do think this is a little different in the situation we were in the first instance, where there was probably more reason for us to continue to have a reserve in some sense. I think that probably those conditions aren't quite the same now. I'll just give you that observation. On the Mariners, Nick, we have talked to the Mariners, and as far as sign off on the county, Nick, would you like to address that?
I'd be happy to, Governor. Thank you. Yes, we did coordinate closely with Public Health Seattle, King County on the large spectator event guidance because, to your point, so many of those sort of facilities exist in King County. So we worked closely with them to come to agreement on all the protocols for those to take place safely.
Yeah, I do want to reiterate, the Mariners are not the only game in town. You know, we care about youth sports too. In fact, we have a slightly different date for youth sports, as I recall, so we can get into the last game of the session, parents and others get to see their teams and their kids play. Nick, can you remind me of those dates, if you will?
Absolutely, Governor. Yeah. So we are opening the more spectators for youth sports on March 18th. So that way we can accommodate some of the last games in a few of the different sports seasons that were truncated due to the shortened COVID sports schedule. So those guidelines will go live on March 18th. So that way more parents and loved ones can watch kids play sports.
Up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. I'm wondering if either you or someone from Department of Health can address what's different. I know the epidemiologic curve is looking much better than it was recently, but it's still much higher than we were back in the beginning. Can anyone explain what's different now than from a year ago?
Well, I'll say something, and then I'll ask Lacey if she wants to add something. Look, the vaccine is the night and day situation. We now have a weapon at our disposal. 3 of these vaccines, they're 95% efficacious, preventing hospitalization and death. There is emerging evidence that they can prevent transmission as well. This is a game changer beyond all imagination. And again, I want to reiterate, it's a medical miracle that exists today. Now, even preceding that, we've experienced some reduction in activity pretty much nationwide. And we've had really great success in our state as well. But we think the vaccines certainly are not going to hurt continuing on that dynamic. Lacey, would you want to add anything?
I think the governor's point on the vaccine is a very strong one. We have 18% of our population in Washington has received at least 1 dose, and around 10 have been fully vaccinated. That does provide us some level of protection. However, the majority of us are still susceptible to COVID-19. So I want to really reiterate the governor's point of all of us continuing our efforts to wear masks, watch our distance. And the other piece related to testing, if you think you might have been exposed to COVID-19 or you are feeling ill, please get tested. Take the test and do what you need to do to protect yourself and your community from spread of this disease. This is how we're going to get out of the pandemic together.
Yeah, one other comment about the masking. Look, if we just got some federal guidance that if you have 2 couples, both are double vaccinated, you have a length of time where the vaccines are going to work, and you're in the privacy of your own home. That might be one measure, but when you're in public around people, particularly in indoor settings, we really, really need folks to wear masks. And the reason is there's still, some question about the transmittal capability of us even after we've been vaccinated. But more importantly, it sets a cultural norm, a cultural expectation, and a reminder to everyone else who may not be vaccinated. So this is one that's really a team effort, and we hope everybody will remain part of the team. One of the main reasons I think the science is showing is why we've been successful in saving lives in Washington is because we all created that cultural expectation. Not just the governor, but everybody wearing a mask were part of that team effort. And I really ask for people to continue to be part of that team in the next several months.
Up next, we'll go to Laurel Demkovich with the Spokesman Review. Go ahead, Laurel.
Hi, Governor. Back to the question on the variant. If we do start to see an uptick in cases because of some of these variants, specifically the Brazil variant mentioned this morning. Do you expect that this move to phase 3 might get pushed back again? And if so, what are some of the metrics, I guess, that you're looking at that might cause that to happen?
Well, we have built into this phase, and I alluded to this, if a county starts to fail to meet some of the metrics we've set out, it could have to go back to the previous phase, and that will be based on a county-by-county assessment. But I am very hopeful that will not happen to any county. I think if we continue to wear masks and our vaccinations continue, and we act safely, there's a reason to believe that won't happen. I can't guarantee it, obviously, but I'm just thrilled that we're all moving forward today as a state, and we want to keep that forward progress going.
Nick, did you have something you wanted to add?
I think the governor captured really well. The way this will work mechanically is that by tracking these hospitalizations, it'll give us good insight into whether or not a certain variant that perhaps causes more hospitalizations is more prevalent and starts to cause more problems. So the system is designed to be responsive to that sort of a scenario. And then just really briefly on the last question, comparing case rates from March 2020 to March 2021, it's really important to consider the volume of testing that we're doing in comparison between those two dates. We're doing, 8 to 10 times more testing now than we were in March 2020. So it's not a direct apples to apples comparison, but we as a state have made such tremendous progress recently with our case rates and hospitalizations. Things are really going in the right direction. Lacey, I don't know if you have anything to add.
Oh, Lacey, we can't hear you.
Just that we have the tools to win the race here, and we are giving Washingtonians, the ability to stay in phase 3 and keep us going forward out of this pandemic. It is us all wearing our masks, watching our distance, getting vaccinated when it is our turn, getting tested if we think we're sick, staying home, and keeping that rate going down. Whether it's variant or wild-type COVID, all of these things protect us.
All right, up next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
This may be for the governor or for Lacey. Can you just speak to a couple of the new changes to the plan, namely the change to 2 metrics rather than the 4, and then the shift from regional back to county level evaluations? I'm mostly curious, were there pieces of the previous strategy that proved ineffective, or what prompted those shifts?
Yeah, if I can, the regional approach had some virtues in that it was medically sound because we tried to develop a plan that was consistent with the medical catchment area of areas that had sort of associated medical delivery system. That made a lot of sense. But we did find that it created a lot of sort of envy if one county was moving forward and another was not, or had better numbers within those regions. And the sense of identity we found of people have with their counties is more pronounced than they do with the region. So we thought this was a better way that would have more public acceptance. And we listened to a lot of folks about that, and I'm confident it is a way moving forward. And I'm really glad we're moving forward as a whole state. Obviously being united in this across the state from Cape Flattery to Walla Walla is a really happy event. So that's good news. Do you want to add anything, Lacey? Or Nick?
I can quickly add on the metrics. We're in a very different place than we were in early January. Our disease levels have come down significantly. We've done a great job of decompressing our healthcare system. And so we're now using metrics they actually are similar. They're just not, as I think the governor describes it as a hairpin trigger as our previous metrics. So we still are looking at cases based on your population, and we are looking at hospitalizations. We just have thresholds based on those rates now, and it's not quite as tight of a turn between phases because we are in a better place thanks to all of the great work of people across the state of Washington and our businesses and communities.
And I would just add really quickly on the why move from regions to counties. So one of the things since the governor announced the hold in phase 2, our office has met with dozens of mayors, county commissioners, and all sorts of other local elected officials to try to hear what's most important to their communities. How does the next phase of our reopening plan impact them? And what do they think is most helpful for their communities as we continue to progress? And one of the things they strongly recommended almost across the board was that moving back to a county by county approach is helpful for the morale of the community to be able to see that they're making progress, working together, continuing to do the right things. And so this was in part influenced by that feedback from those local elected officials.
All right. Up next, we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Two-part question. I think the first is technical. If you could elaborate a little bit on under phase 3, the attendance for minor league baseball sounded like there might be some tweaks, and the state fairs and fairgrounds like Puyallup and Evergreen up in Monroe, how it will be handled. And then secondly, Governor, did you have concerns about the upcoming St. Patrick's Day celebrations, and did that concern cause you to choose March 22nd for the start date as opposed to this coming Monday?
Well, we believe in the luck of the Irish, but March 22nd was based on our scientific assessment rather than luck or the wearing of the green. So that did not figure into it. And I'm sure everybody's going to be safe and enjoyable on St. Patrick's Day. As far as the minor league games, we are at 25% capacity today. We are intending to evaluate that in mid-April because minor league teams don't have TV revenue. Frankly, it's a little more difficult for them. So we're going to find out in mid-April, could we possibly boost that up to 50? We don't know the answer to that yet, but we are going to take a look at the success of some of the larger events and see if they're having success. We hope that that'll be the case.
Nick, did you have anything you wanted to add on that?
Just specific to Jerry's question about the county fairs and other sort of large scale events. So important reminder that for the large spectator events, to be able to get over the 400 person capacity limit and get to that 9,000 like the governor was talking about for some of these professional sporting events, the requirements will be that they have individual permanent seating. So like a fair where people are up, walking around, constantly moving, that wouldn't meet the criteria to get up to those larger numbers. They would still be capped with the regular outdoor events of up to 400.
All right. Up next, we'll go to Drew Mickelson with King 5. Go ahead, Drew.
Good afternoon, Governor. Just to expand on that last question, you know that restaurant owners have been clamoring to open to 50% plus for weeks. Why make them wait another 11 days? Why not let them flip the switch tonight?
Because variants are alive and well, and they keep bursting forth, and we need a little more time to make sure that we are in this continuing improving trend. If you look at the curve, we are seeing some progress in this regard, but we needed a little more time to give us a higher level of security. And I'm glad we're moving forward. This will also give the restaurateurs a chance to prepare. One of the things that they've continually talked to us about is trying to get advance notice so that they can prepare their staffing and their food resources. So we're giving them more time to prepare as well. And we're very happy to be able to move forward.
Nick, did you want to add anything?
I would just, to build on the governor's remarks, the reason March 22nd is helpful is that it allows additional time for more of our over 65 population and others that are currently eligible and will become eligible next week to be vaccinated. And the connection between vaccine and reopening is really critical. Those two things work together. So March 22nd allows for more time, for more shots in arms, so that way more people will be safe.
By the way, huge progress. We're over 60 now. We think we're probably over 65% by maybe late next week. And we're just really happy about the progress we've made. But we're not done. Again, I want to reiterate, people in that age category continue to get vaccines even after March 22nd, if you so desire. Lacey, is that about the right assessment late next week? 65, do you think?
Yes, I think that's a good estimate, Governor.
To Keith Eldridge with Commonwealth. Go ahead, Keith.
Governor, you said you're hoping that counties won't have to go backwards, but if you look at the numbers now, places like Whatcom, Lewis, Yakima counties, all will not be able to stay in phase 3 if you keep the numbers where they are. Is it fair to keep those numbers that they considered too low?
No, we think continued progress is available in those counties. There's every reason to believe we can do that for a variety of reasons. One, we're getting more vaccines coming on big time, and this is a measure of progress. I want to note that we've hit this level of senior citizen vaccination a week or 10 days faster than we thought we would. And that is because the DOH and our local partners have been successful in accelerating dramatically the rate of vaccinations. So you can't overstate the power of these vaccinations to reduce hospitalizations. We've had a dramatic drop in hospitalizations, in part because of these vaccinations. So that's a powerful tool. All of these counties have it available to them, and they have the ability to use masks and social distancing as appropriate that is still available to them. So we think that they can continue to meet these metrics if everybody stays on board and keeps pulling on this rope. We ought to be optimistic about that.
To quickly add to the governor's remarks, they have until March 12th, right? So our first evaluation against the metrics for any backward movement isn't until March 12th. Those communities and their epi curves are on a nice downward trend, and as long as they continue to maintain that and make that progress, you know, once they transition into phase 3, their trajectories look good to be able to maintain that phase 3 status.
Nick, you said March. You meant a different date.
Sorry, April 12th. I apologize. April 12th.
So we got a good amount of time to continue to show progress.
All right. Up next, we'll go to Brandy Cruz with Q13. Go ahead, Brandy.
Hi, Governor. Going to try to fit 2 in quick if I can. There was about 2 months between when you announced the metrics for phase 1 and 2 to when we now have the metrics for phase 3. Just to set people's expectations on the front end, should we expect a similar timeline before we know what the next phase would look like? And then I also was hoping you could weigh in on the Governor Cuomo situation.
Well, I think that, how do I characterize this? First off, I can't give you a timeline. I'd say it's probably more probable that it would be shorter rather than longer because I am very optimistic about the efficaciousness of these vaccines. I think they're going to knock it out of the park. And if that continues to be the case, I think there's a chance, I think it's a probability it would be shorter rather than longer. The situation is New York. We know in any of these events, we have to consider these assertions serious, and they demand a serious investigation. And I believe that should happen in New York as it should in any place to any public figure of any party. And I hope that that'll take place in New York.
All right. Up next, we'll go to Casey Decker with CREM. Go ahead, Casey.
Are there any changes to the protocols for private gatherings, private social gatherings? Right now, I believe it's limited to 2 households up to a certain number of people. Will phase 3 see any changes for those kinds of gatherings?
I don't believe so. Nick, can you help on that? I don't think we've changed anything in that regard.
We are, those details are still being worked out, and that's part of what we'll figure out and get published with all those other industry specific guidelines for next week.
If I can, just a note on this too. I really hope people who are doubly vaccinated, look, if you have 2 couples over, they want to sit on the couch and have a cup of coffee, and they're both double vaccinated, and a period of time has lapsed, so we know that it's highly efficacious. You know, that's one instance, but when you're out in public, I believe that we still need to wear masks, again, to encourage others to wear masks, and realizing that you still may have transmission to a person who's not vaccinated. There is still a risk of that. We think the vaccines help in that transmission, but there's still some uncertainty about that. So I hope when people think about this, they can think in one environment in your home is very different than your environment outside of your home in public places. I hope people think in those terms.
All right. Up next, we'll go to Mayor Kawash with KXLY. Go ahead, Mayor.
Hi, Governor. I noticed you guys have grouped all indoor spaces as one restriction now. Why is that?
I'm not sure I understand your question.
Over the past several months, we've had certain nightclubs be worried about their licensing because they couldn't open like restaurants or bars. Now, under all indoor spaces, is it all grouped as one? And why so?
Well, we feel it's appropriate given what we know about the science. Now, there are still some prohibitions on certain type of industries. And do you want to outline those, Nick?
Yeah, I'd be happy to. You're absolutely right that we have made a lot of progress and effort, intentional effort, over the last several months, and as we transitioned into the Healthy Washington plan, to bring indoor activities that are similar onto the same indoor occupancy percentage. So, for example, in phase 2, we've had grocery stores at 25%, restaurants at 25%. Fitness facilities at 25%, those type of indoor activities at the same occupancy percentage. That same sort of model where we have the same percentage for those indoor activities is going to follow into phase 3. So grocery stores go up to 50, restaurants go up to 50, gyms and fitness facilities can go up to 50 as well. In terms of nightclubs or other sorts of activities like bars, we are continuing to work with those sorts of operators and proprietors to help them either change over licensing requirements or in other ways change the way that they serve their patrons so that way they can conform to the type of guidance and maybe a nightclub actually behaves, feels, and looks exactly like a restaurant. There aren't people up dancing around. They're just people sitting at tables eating. So for all intents and purposes under the guidance, they're like a restaurant. So those are some of the things we've done to try to really help business owners be able to operate within the confines of the guidance and then continue to maintain that stable, consistent occupancy percentage across industries.
All right, we've got time for one more question, so we'll go to Jack Russolo with the South Seattle Emerald. Go ahead, Jack.
Hello, Governor. I'm curious as we've been getting more vaccines, the Johnson & Johnson one came in, and Lumen Field was designated to be a max vaccination site, if there will be any more max vaccination sites coming in, especially on Western Washington, or any other ways that you're working with local jurisdictions to make sure that more and more people can continually get vaccinated.
Well, we obviously want to have the capability to do substantially more vaccinations because we're going to have substantially more doses. And the good news is we do have that capability to do that. Our Department of Health has looked at our existing logistical capacity, and it is substantially more than we're using right now because we still don't have enough doses. So we have today hundreds of people ready to go to start the vaccination process, service providers that we can't get doses to yet. So we have way more ability to do way more doses today that we could start at noon tomorrow if we simply had the doses. So that capacity is ready to go in hours. So that's really good news. But there still is a possibility that we could do additional max vaccination sites. I wouldn't rule that out. But we have really opened up the number of providers, including the federal pharmacy plan and the federal government vaccinating veterans in the VA hospitals. So we got a lot of places to get shots in arms right now. They're ready for the doses. And again, huge shout out to President Biden and the work he's done to increase these dosages. We're just thrilled by this. I also note that we are continuing our efforts to improve the equity of access to these vaccines. We are looking at every possible creative way we can to get folks who don't have as much access because of mobility, because of language. We want to have equitable distribution to the BIPOC communities, and that's why we're continuing our outreach efforts in 32 languages. We're spending $15 million to connect with people, and we're encouraging local communities to be as creative as humanly possible. So when I was at the mass vaccination site in Pierce County in Puyallup last week, I talked to the local folks who were having multiple sort of pop-up clinics where they would have a community group that had an underserved community, and the health department there would work with that community group to contact people in their community, frequently people with limited language or limited transportation needs, to come into these decentralized sites and actually get your vaccine. So we're encouraging that, we're enabling that. I was also encouraged at the Lumen site that there will be multiple ways to make an appointment. We know some people of age or language have difficulty with computer access. So we are trying to encourage having phone access where you can make a phone appointment where people have more access to phone usage. And they're doing it at Lumen, they're doing it at our MaxVac sites that the state has set up as well. So we're using these multiple strategies. It's very important for us to be alert to inequity in this process.
Remarks?
No, I just want to thank everybody for their work. There's a reason we're the best state in the United States, and this is another piece of evidence of that. So in summary, I'll just say this: play ball.